Okay, so on my concept map, sodium and chloride with the hypochloremia, hyperchloremia, hyponatremia, and hypernatremia. So the relationship is hyponatremia occurs when the concentration of sodium in your blood is abnormally low. Sodium is an electrolyte and it helps regulate the amount of water that's in and around your cells. Signs and symptoms: convulsions, fatigue, headache, nausea, vomiting, muscle weakness, spasms, and cramps. The interactions of ions in the body for sodium and chloride. Chloride is absorbed in the small intestine and remains in the body's fluids and blood. Any excess amount is excreted in the urine. Chloride is usually bound to sodium, and therefore the amount in the blood tends to coincide with sodium levels. The medical importance: sodium helps maintain normal blood pressure, supports the work of nerves and muscles. One or more factors ranging from an underlying medical condition to drinking too much water can cause the sodium in your body to become diluted. When this happens, your body's water level rises and cells begin to swell. This can cause many health problems from mild to life-threatening. Potassium with the hypokalemia and hyperkalemia. The signs and symptoms are cardiac arrhythmias, palpitations, constipation, fatigue, muscle weakness, and spasms. The medical importance: early treatment and diagnosis can help prevent the condition from developing into paralysis, respiratory failure, or heart complications. The relationship: hypokalemia and hyperkalemia occur when potassium levels are below 3.5 mAg per L or greater than 5.0 MEq per L. Your body gets potassium from the foods you eat, and hypokalemia is often caused by an excessive loss of potassium in your digestive tract due to vomiting, diarrhea, or laxative use. The interactions of ions in the body: hyperkalemia can result from increased potassium intake, decreased potassium excretion, or a shift of potassium from the intracellular to the extracellular space. The most common causes involve decreased excretion. So the calcium and phosphate: hypocalcemia, hypercalcemia, hypophosphatemia, hyperphosphatemia. The relationship: hypercalcemia indicates a concentration of blood calcium higher than normal. The normal concentration of calcium and phosphate in blood and extracellular fluid is near the saturation point. Hyperphosphatemia is abnormally high phosphate levels, can increase from phosphate intake or decreased phosphate excretion. The medical importance: elevations can lead to diffuse precipitation of calcium phosphate in tissues, leading to widespread organ dysfunction and damages. When calcium levels in your blood become abnormal, your body might experience harmful symptoms. Without treatment, low phosphorus levels may lead to complications, especially if there is also a calcium imbalance. If severe enough, it can be life-threatening. The interactions of ions in the body: The interaction between calcium and phosphate is complex. Because these ions both support and counteract each other, the supporting effect is due to a simultaneous uptake and translocation of calcium and phosphate. Signs and symptoms are fatigue, weakness, anxiety, increased sleepiness, muscle cramps, numbness, and tingling. Magnesium for hypomagnesemia and hypermagnesemia. The signs and symptoms is nausea, vomiting, muscle weakness, personality change, lethargy, and seizures, among other things. Interactions of ions in the body. Magnesium is a cofactor in more than 300 enzyme systems that regulate diverse biochemical reactions in the body, including protein synthesis, muscle and nerve function, blood glucose control, and blood pressure regulation. Magnesium is required for energy production, oxidative phosphorylation, and glycolysis. Medical importance. Magnesium also affects the electrical activity of the myocardium and vascular tone. Patients with hypomagnesemia are at risk for cardiac arrhythmias. The relationship hypomagnesia happens when you have a lower than normal level of magnesium and electrolyte in your blood. It can be mild or severe and is treatable. It often happens alongside low calcium and potassium levels, which are also electrolytes.